Hello everyone, today we are going to talk about erectile dysfunction, ED. Most people have sexual issues at some point in their life, such as erection problems and premature ejaculations, which can have a negative impact on their enjoyment with a partner. If you're a man who struggles to maintain an erection or making it last longer, this video is for you. But having erection problems from time to time isn't necessarily a cause for concern. In this video, we'll discuss everything about this common condition, including its causes, how can it be treated and avoided. Our role today is to answer most of your questions regarding erectile dysfunction, ED. Today we have Doctor Jeong, who is a leading doctor at Stantop Clinic. He is going to discuss with us everything about ED from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so next time you'll be updated with our new releases. 안녕하세요, Dr. Jeong.
Yes.
How are you?
Hello.
So can you introduce yourself to our audience?
My name is Doctor Jeong, and I work in the Department of Urology in Stantop Urology Department in South Korea. I am in charge of surgery and outpatient.
So for our first question, what is actually erectile dysfunction or ED?
Erectile dysfunction means that sexual intercourse is difficult because it does not work when sexually excited or does not last even if it is erectile.
So what causes ED?
There are various causes of erectile dysfunction. Erectile dysfunction is one of the aging phenomena and is caused by psychological and physical parts. Erectile dysfunction in young people is almost a psychological problem. It can occur when people with anxiety about sex, personality, sensitivity, or not having much experience in sex are psychologically anxious. Physical causes can cause erectile dysfunction when you are unable to maintain your health due to diseases such as diabetes and high blood pressure, frequent smoking, and frequent drinking. In addition, aging or chemotherapy can cause erectile dysfunction.
Okay, so what are the treatments for erectile dysfunction?
There are 3 treatments for erectile dysfunction. The first is medicine, the second is injection, and the third is surgical treatment. Drug treatment proceeds with drugs with ingredients such as sildenafil or tadalafil, which we commonly know. These drugs help with erecting rather than treatments. You can take this medicine in advance when your erection is not smooth so you can have a good erection. Second, there's an injection treatment when these drugs do not work or there are side effects. Injection treatment is cell therapy, so you can directly get medicine from the hospital and inject it directly into the penis. This is also not a fundamental treatment. There are several recently developed physical treatments, which can be seen as physical therapy as a way to enlarge blood vessels in the penis and regenerate blood vessels. This treatment can be more effective because it is a fundamental treatment than medicine or injection treatment. However, if these treatments are not effective, and if you are older, you can proceed with implants treatment. There are 2 main treatments. One is the treatment of curved implants, and the second is a treatment of expandable prostheses that can be expanded or made small when you want.
Is erectile dysfunction related to prostate disease?
It cannot be said that there is no connection at all. Having a disease in the prostate does not necessarily cause erectile dysfunction. If you have prostate asymmetry, prostate inflammation, and prostate cancer, these prostate diseases can have a clear effect on erectile dysfunction because the nerves around the prostate directly affect the erectile.
So today we learned many things about erectile dysfunction, and the doctor discussed everything about this prevalent illness, including how it may be treated and prevented. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we will respond to you as soon as possible.